This is the story about lives saved and lives changed. This is the story about people coming together for one common cause. This is a story about the latest in science and the timelessness of compassion. This is the story of the Cardiology Division of Healthcare Partners. The story begins back in 2010 when Dr. Sharif Abdou had a vision to change how specialty care was delivered to patients in a way that enhanced their overall wellness. To do so, Dr. Abdou knew he had to get to the heart of great care in every sense of the word.
Cardiology is always a very important integral part to a large medical group. Cardiac diseases are always one of the biggest diseases to manage, one of the most costly diseases. So a large medical group would want to have a strong division to help care for their patients.
Cardiology and cardiovascular diseases is the #1 killer of men and women. It's the most prevalent disease process, and without cardiology, we're losing a great deal of patients.
With this knowledge, Dr. Abdou knew he needed to meet the needs of the patient population. In June of 2011, he found Dr. Stephen Ports, who joined Healthcare Partners as the new division chief of cardiology. Dr. Ports sought longtime colleague Dr. John Badato to join him in opening the new division. In October of 2011, the two opened the doors of Healthcare Partners Division of Cardiology at Southern Hills Hospital. It was a unique opportunity for these dedicated physicians to build a specialty center from the ground up, with equipment and staff dedicated to cardio care. And it was highly successful, so much that the team was looking to meet patient demand with an expansion. In 2012, that expansion took shape as the acquisition of Cardiovascular Consultants of Nevada, or CCN. Dr. Jerry Ruth had been with CCN since the 1970s and played an essential role in bringing the teams together.
It's been an interesting transition because CCN started out and wanted to be a cardiology group that basically led the community in expertise and caring of patients. And we're built on the model that if we did that, we didn't really worry about finances because we felt that patient care was excellent. Healthcare Partners came along and had that same ideal, but they offered us some other things, such as the management aspect of it and a large group. And so that became interesting to us. Since we've joined, I think that has continued to grow, and that aspect of it continues to need to grow as we enter the future.
Healthcare Partners Executive Director of Specialties, Matt Grimes, also helped bring the groups together.
Anytime you're looking at another group to bring on board, to become teammates, I think it's important that they all have the same core values.
So it was about more than finding qualified specialists. It was about aligning with professionals who shared their vision, their passion, and their drive to elevate the standard of cardio care in Southern Nevada.
We knew each of those doctors very, very well, and they all basically fit the same values and the same ideals and the same quality of care that we wanted to deliver, and that was an easy transition for us.
And the good thing about all of them, not only are they very good physicians who deliver very good care and ethical care to the patients, they're also, to the T, every single one of them, very good people. And I could happily call any one of them, a friend, or know that they are going to always do the right thing for their patients.
The reputation of the cardiology group was, again, undoubtedly the right doctors to work with, who are concerned more about quality and effectiveness and efficiency than they are particularly about their own egos or individual accomplishments.
Cardiovascular Consultants of Nevada, or CCN, had been a leading provider of cardio care since the 1970s. In fact, many of these doctors had worked together before. The acquisition of the company meant the coming together of professionals who had a shared history and a common purpose. One of those professionals is Dr. David Navratil, Director of Electrophysiology.
We joined Healthcare Partners essentially for the opportunity to basically continue to expand our presence in this community We joined also for the concept of improving our ability to deliver broad service cardiovascular care to the individuals, patients in the Las Vegas area.
I jumped right in right away, and again with a great group of people, all with same goals in mind, which is to put patient care first and deliver good quality of care.
It's about the best and the brightest, and I feel proud to be associated with this group because I do think that they truly are the best and the brightest that we have to offer in our community.
Together, the doctors of the Healthcare Partners Cardiology Division embarked on a mission to redefine cardio care in Southern Nevada, a mission that was furthered by the acquisition of Healthcare Partners in 2012 by DaVita, a Fortune 500 company with a proven history of excellence in healthcare. With this momentum came a number of breakthrough procedures, such as Nevada's first electrophysiology and catheter cryoablation, performed by Drs. Narula and Bensler in 2012. A groundbreaking TAVR procedure performed by Drs. Herbert Cordero, Howard Broder, Stephen Ports, and Jeffrey Levisman, also in 2012. And the first Avera MRI implant in the Western United States, conducted by Dr. Narula in 2014. As the cardiology division has grown, so has its number of well-known physicians, such as Dr. Eric, Dr. Lamoth, Dr. Patel, and Dr. Khan, and the division continues to attract the most skilled doctors in cardiology, including Dr. Levisman, Dr. Danielian, and Dr. Joshi. The important work of these physicians is made possible with the dedicated support of Blanca Tennant, Doreen Kibbe, Tanya Mata, and Brittany Markman. Along the way, the Healthcare Partners Cardiology team focused on providing patients the kind of care that helped enhance their wellness and their quality of life, fueled by the organization's total care model. In this approach, primary care physicians and specialists share information in real time in order to work more collaboratively toward healing their patients. It's a convergence of primary care, specialists, nutritionists, and more, all in the interest of better health with greater efficiency.
The total care model provides excellent care and transitions from the inpatient and outpatient care, as well as the several specialties, including cardiology, with the goal to keep patients healthy and promote well-being throughout the community.
The total patient care model is important because what we are doing now is taking care of the patient and the whole problem, not focusing on what we can do as an individual, but dealing with that as a group of individuals that are looking at the patient.
If we can do a better job of managing cardiac wellness as well as cardiac disease, that really elevates the total care model.
And we put it into practice with a team approach, and I think that's what makes Healthcare Partners somewhat unique. You know, we utilize all of our available resources to take care of the whole patient, not just one cardiology problem.
A collaborative approach results in seamless service between specialists and primary care docs, and that translates to better care.
It has a huge impact on Healthcare Partner patients, especially as a primary care physician. There have been so many opportunities in the past when we didn't have the cardiology group, where we had a patient in our office and they were stable, but you were kind of really concerned about them and you really just needed them to be seen by a cardiologist.
For Healthcare Partners Cardiology, it's about more than treating patients when they're sick. It's about keeping them from getting that way in the first place. That's why the division actively engages the community with events that educate, inform, and entertain. It happens through initiatives like the Big Hearts Heart Walk, physician meet and greets, healthy lifestyle events, heart-friendly cooking classes, and more. At the heart of it all is the core values shared by the doctors and the entire Healthcare Partners family.
The core values that Healthcare Partners have are all very important. They are ones that a physician who completely cares for their patients, you would think would always have those. And those are to always continually to improve our care and deliverability and accessibility, the integrity so that patients know that when I say that I'm going to do this for that patient, they know that that is going to get done, and to the best of my ability or our ability that we are going to help this patient get better.
My favorite value is actually fun. I really enjoy what I do day to day. I enjoy getting to know my patients, getting to help them out, getting to meet their families, and really they let me into their lives, and I'm able to help them to make their lives better. And I'm able to do that with a group of people that all have the same goals in mind.
My favorite core value would be service excellence. Service excellence has been the mainstay of my practice and how I've wished to treat patients, and I've been able to continue to do that in the environment of healthcare partners.
Together with accountability, continuous improvement, and fulfillment, the core values of service excellence, integrity, teamwork, and fun are what drives Healthcare Partners Cardiology to do more, offer more, and provide more for their patients. And the community is taking note. Prominent publications have named Healthcare Partners Cardiology Division physicians among their elite listings of top doctors, including Drs. Ivy, Badato, Ports, Cordero, Heron, Navratil, Ruth, and Cerulnik. But for this team, the real reward continues to be healing the patients they serve.
It's always been about the medicine. It's always been about the care. It's always been about the appropriateness of service to make people better and integrate their care in a more coordinated fashion.
These are cardiologists that have been in Las Vegas for 10, 15, 20 plus years who wants to join Healthcare Partners because they believe in what we're going to do and how we're going to transform healthcare and do cardiology the right way, and patients come first.
That was one of the most exciting reasons that I came to Healthcare Partners, because of this opportunity to really make an impact, to not have to worry about the bottom line every month when you are in private practice, that I could actually spend a lot of my time and energy really devoting care, preventative care, to patients.
Keeping the trust. Perhaps that's the heart of the Healthcare Partners Cardiology Division story. It's a story that continues to be told with every life saved, every patient healed, every single day.
Far from perfect,
far from done.